Helpline. Thank you so much for joining us. Inshallah, every Saturday we'll be having these webinars with different experts, different backgrounds, discussing mental health and how important and relevant it is in this day and age, especially during the pandemic, and how it impacts all of us on so many different levels. Today, alhamdulillah, we are joined by Dr. Mustafa Salehmohammed, who is the medical lead from Nasimco, as well as Brother Muhsin Kermalli, the head of development from Naseeha. So inshallah, we'll begin. So it's going to be a discussion with lots of questions back and forth related to the topic today in terms of demystifying mental health, having a better understanding of what it is in terms of what it is these different organizations are doing in terms of supporting the Muslim members of our community, inshallah. So first we're going to begin with Dr. Mustafa, who's going to be telling us a little bit more about himself and about Nasimco and the role that Nasimco is doing in terms of exploring mental health and how to support the community, inshallah. So welcome, Dr. Mustafa. Assalamu alaikum.
Walaikum salam, Sister Berak. Thank you so much. So just a quick background of my medical profession. I am a pulmonologist and critical care physician by trade, or what they call in Canada, respirologist. Just to give you a brief overview of what Nasimco is, Nasimco was established in 1980 as a Shia ithna-asheri umbrella organization with the purpose of unifying the North American Jamaats and to provide support and resources to the communities under it. Its vision was to provide a common structure and framework to meet the religious, cultural, and social needs of the communities that within its area of operations. Its mission was to harness talents and resources available in member communities for the greater good of global humanity and our communities. I'm just going to enumerate a few things that Nasimco has done and is continuing to do. At the local level, there's many charity initiatives that are ongoing, and our goal is to support the communities within the umbrella first. At a global level, it's supporting more than 600 orphan students in Iraq. It's supporting poverty-stricken students in Tanzania. It's supporting widows in Pakistan as well. Other aspects of Nasimco technologically, last year Nasimco launched an app which has features such as live majlises, 24-hour channels, namaz timing, news of death, and many other things. It organizes annual ladies' retreats. On the education front, through the Center of Islamic Learning, it had its third year rollout, and it's had its leadership development program. And then we come to the health part of it, which has to do more with my field. And with today's topic of mental health, and Nasimco hopes to tackle issues such as drug addiction, domestic abuse, and wellness, and team up with organizations such as Naseeha. And we have the medical subcommittee, under which we've created a COVID-19 task force. And the task force is mainly to deal with medical questions, medical help, as well as economic help, because economic strain is going to be major in this fight against the virus as well. And we've set up a relief fund as well. From the mental health perspective, we also have a crisis phone line, and I'll just plug the number in right now. It's 1-833-786-1101. And we have a COVID website, covid19.nasimco.org. And a lot of information can also be found on our Nasimco app as well.
MashaAllah, there's so much that this organization has done for the Muslims and the Shias in particular in Canada since it's first developed. And it's amazing to see how we've developed from the basic needs of what we needed in our community to medical, but now looking at mental health and how important this is. So I wanted to ask you, why are we taking this initiative? Why is Nasimco now exploring the topics of mental health within our communities, especially since overall within the Muslim community, it is a taboo topic. It's something that's got a lot of misconceptions and stereotypes around it. So why has Nasimco taken this step as a major organization in Canada?
Especially, the stigma, as you mentioned, the stigma of mental health problems have existed in our culture for far too long without our attempting to acknowledge it and address them in a humane and professional manner. Thank God we have professionals like yourself that help us do this now. Our communities, just like in the general population, have been dealing with this problem. It's a very real problem, and what Nasimco wants to do is we want our members to know that we are here to support and help them in any way we can. Now, this endeavor had its roots not just from this current pandemic. We were even talking about this prior to this.
That's right. Yes,
Yeah, so we've been working with you guys and wanting to help. You know, we've had a drug addiction problem. We've had depression, anxiety in general communities and in our communities. And now with the COVID-19 pandemic, you know, the emotional, the physical, and spiritual strain is worsening. So we're concerned about a rise in anxiety and stress that could lead to psychosocial harm, detrimental effects such as increase in domestic violence, worsening addictions, worsening suicide rates within the communities. You know, basically the suffering of those in silence, of the vulnerable. So what Nasimco has done is it's teamed up with organizations such as Naseeha, and then Brother Muhsin is going to elaborate on that as well, to help us with this current situation and other difficult times that we're going to face in the future. This is a pandemic. We're sure to face other difficulties in the future that's going to cause mental health strain to our community members. We also have mental health professionals such as yourself, Sister Berak. So with organizations such as Naseeha, and Naseeha is conducting many workshops, and we hope to work with them to conduct more workshops throughout North America, and with mental health professionals such as yourself. You both, as an entity, you both selflessly serve the purpose of raising this awareness and providing the necessary tools to combat this suffering. So we want our brothers and sisters to know that they're not alone, and they do not have to suffer in silence. And our goal is to educate the communities and empower them to help them take that next step in getting help, inshallah. So.
Inshallah, bless you for the recognition of how important this is within our community, how there are mental health issues within our community. And it's also as a Muslim organization, we want to jump on that and take the initiative to acknowledge and say, this is important, we do care about you. And so what is it that you want the community to get out of this? And also, Doctor, from a medical perspective, from a sick person perspective, in terms of how this whole project can impact them?
Well, it's the community members are dealing with it, and just as in the general population, many anxieties. You first have the anxieties about getting the virus itself. In the medical world, we use this term called, it's an acronym ADL, or it stands for Activities of Daily Living. Well, activities of daily living are no longer what they used to be. Just going to the grocery store or going to the pharmacy to get your prescriptions, just the essential things. They've become nerve-wracking endeavors. We have to go outside wearing a mask. Wear a mask for a few hours and you'll see it's not as comfortable as one thinks it is. And having done this at work quite a bit, I know the feeling, and that feeling of claustrophobia for some or for many can just trigger anxiety and panic. Then you have this mental strain of social distancing, and we are in the holy month of Ramadan.
I prefer to use the word physical distancing, because the reason why, as soon as we say social, we're separating people, right? When you say physical, we want to make sure we're physically apart, but it doesn't mean we have to socially stop interacting.
Absolutely. But that's as well as causes strain in that, because that term is used so much. And we're in the holy month of Ramadan, and Muslims, just like peoples of other faiths, are communal in nature. We like to get together physically. We like to be together. The sadness of not being able to interact in person or to going to our centers and masjids is a major concern, especially to our elders. And they depend on going to the centers and to the mosques because it's their principal means of social interaction. Just basic things like constantly washing your hands or using hand sanitizer. Yeah, we wash our hands. Yeah, we keep clean, but now we're doing it, at an exponential level. So these basic little changes our routines. It changes our daily life. Then there are many of our community members who they're essential workers, not necessarily healthcare workers, but they're essential workers. They have to go out and work, and they're constantly exposed, and they have their anxieties, not just for themselves, but am I bringing this virus home? Especially if they have family members who are elderly or who are sick or who are immune compromised, and they're worried about giving that to them. So you have that anxiety. Then you have the anxiety of once you are sick from this. There are many people who have gotten sick from this, and now that I have it or my loved one has it, how bad is this going to get? How much of a risk is my life at? Am I going to spread it to someone else in my family? If something happens to me, who's going to look after my family, right? There's always those guilt issues as well. If I become chronically debilitated from this, will I be a burden to my family? And, and those anxieties, once you get better, thank God, hopefully that happens to most of us, if not all of us. And, you know, then there's the recovery phase anxieties, and you're talking about, will I get back to 100% of what I had? Will I get back to work? Will I have work to get back to? There's, in the United States, unemployment's up to 30 million. That's major, you know, that causes major anxiety and depression in many. So, and you know, you mentioned as far as healthcare workers go, that's the last concern I wanted to sort of address, and it's a very personal concern. Several of our community members all across North America are working in the front lines in healthcare. So we deal with death in our professions, generally during non-pandemic times. Now, during this pandemic time, we're dealing with death in so much more significant numbers. As much as we've dealt with death in our professions, this can be overwhelming. This is something new. Recently in New York City, in the New York Presbyterian healthcare system, an emergency room physician who was actually the director of the emergency room, she committed suicide. She had dealt with death. The emergency room physicians deal with death all the time, but the amount of death that they were dealing with this pandemic was just overwhelming for her. And you know, physicians or nurses or healthcare practitioners have this thing of, no matter what, we want to help everybody and anybody. We don't want to give up till the end, and not being able to help these patients. Something like that can stay with a healthcare worker.
And I think that's a testament to the statistics that we've been seeing. For example, the Agnes Reed Institute poll said that their mental health has worsened, including 10% who said that it has gotten worse. Half of the respondents said that. And so the report also announced Thursday by the Mental Health Research Canada, where they asked around 1,800 people about the state of their mental health, and they found that the feelings of anxiety and depression are steadily rising. And so we can see before COVID, 5% of Canadians reported these high to extreme levels of anxiety. And then 5 weeks later, we see that the number has multiplied to 20%. So, and these are self-reported cases of depression. These have doubled, more than doubled, from 4 to 10%. So we see here that anxiety appears to be worsening among healthcare workers as well, with 43% feeling that high level of anxiety since the pandemic began, compared to only 14 before. So there's research that is it's not just our feeling of what we think or our assumption was going on, but there's actual statistics that show that in fact this is happening. So how do you feel about this? I know you said this is very personal for you, but can you elaborate a little bit more about this, please?
Yeah, it's and I can see that getting up to 43% and even more. And how I feel about it is I feel anxious. I feel, you know, I've worked in the ICU. Those days that I work in the ICU are very anxiety prone days, you know. We're exposing ourselves, and my concern is always, I'm coming home, am I exposing my family? You know, and we've seen, you know, we hear about elderly getting sick and dying from this, but we've seen young patients get sick from this. So we always worry, you know, is this something that I'm going to become sick from? You know, and the concern is many. The first concern that comes to our mind is, as it is, we have healthcare workers who are falling sick, and so we have a shortage. So if I fall sick, how am I can't help anybody, you know, and that's our first goal, is to try to help people. So, you know, that's our first concern. And then our families, well, who are we giving this virus to? You know, and again, it's the same thing that I spoke about before, is it's, you know, we always feel like what will happen to our families if something happens to us? So yeah, the anxiety is definitely skyrocketed. And you know, many of us are very, you know, we're strong-willed, we're strong-minded. But even amongst my colleagues, I've seen that this is really taking a hit on us. You know, and then when we come home, then we have that other stress of we quarantine ourselves from our family. So it's very difficult, especially
so even though you're in the house, you're in the same house.
So I've been quarantined for close to 2 weeks now from my family, just to make sure. Yeah, so just to make sure that, you know, I don't give them anything. You know, God bless them. My wife and my kids, they drop my star out at the door, and I get that. But there's that proximity that during Ramadan, sitting together, you know, reciting our du'as together, it's you know, that's taken a toll as well. So those are the issues. You know, several issues. The general public, our community members, our healthcare workers, we're all dealing with this, and many of us will need help and support at some point and in some form or the other. So, and that's what Nasimco wants to do. He wants to be there for our communities and their members who need that support.
Bless you. And on behalf of all of us who are watching and everywhere, bless you and all the healthcare workers who are on the front line and risking their lives and their families to help save other lives and battling this. And I can only imagine the mental impact that it has on you, and bless you. And there's only so much we can do other than sending du'as. And hopefully you do have, and other frontline workers who have access to counseling supports. And I know one of my colleagues, Sister Anisa Diab, is working with frontline workers while she does virtual counseling, and she describes a lot of the stress and the anxiety and fear that the frontline workers are working. You know, you're doing your job in terms of saving lives and helping people, but then there's this added pressure and fear, and worry of the future of what's going to happen bringing this home. And subhanAllah, it's something we've never really had to experience before, and we're all stumbling along. We're all trying to figure things out along the way, and this initiative, inshallah, is one of is a response, so to speak, to help bring awareness and support into our communities, inshallah. Thank you so much, Doctor, for your insight. We really appreciate that. God bless you and Nasimco and your family, and all that you do to help in fighting this pandemic. Bless you. Thank you so much.
Thank you.
And now we have Brother Muhsin from Naseeha, who's going to be presenting in terms of who's Naseeha, what it is that they do, their purpose. And Naseeha and I go way back. We've done lots of work together in the past, different presentations in different communities. And it's wonderful to see the different groups all come together to work to provide services for our Muslim community. Alhamdulillah. Welcome, Brother Muhsin.
Assalamu alaikum, Sister Berak and Brother Mustafa and everybody else who's watching. So, alhamdulillah, I'm just going to kind of do a little bit of a different presentation than Brother Mustafa. Mine's going to be more on a PowerPoint slide, just talking about who Naseeha is, what we're doing, and then inshallah we can take it from there. So I'm just going to share my screen. Inshallah, you guys can all hopefully see that. Thumbs up. Yeah, we're good?
We're good.
Yep.
Okay. So before I start, I just want to say, on behalf of Naseeha, we're really excited to partner with Nasimco, other organizations. Having Berak here as well is very important to show, all the member Jamaats that are tuning in that, look, this is a real issue, that mental health is health. And Naseeha, what we're trying to do is obviously break stigmas through the support that we have. We're out there educating the community. We're out there doing our workshops to the community. And obviously we have a, telephone peer-to-peer support helpline. So today I'm just going to be talking about what Naseeha is, who Naseeha is, what kind of work we've done in the past, where we're going in terms of this partnership with Nasimco, inshallah. And then if there's any questions or discussion points on that. So the first slide, I really want everybody to remember, obviously, the 1866 number. So we operate a toll-free peer-to-peer support helpline through North America, where anyone who's suffering from any sorts of issues can call in. And I think Dr. Mustafa touched on it, that our ultimate goal is to be here for people who are suffering in silence, and for people to realize that they should never be a point in their life where they've lost all that hope, where they feel like there's nowhere to go. That the 1866 number is there. It's 1-866-627-3342. Currently, our call line is open 7 days a week, 12 p.m. to 9 p.m. Eastern Standard Time. And we are also now available via text services, Monday to Friday, 12 p.m. to 5 p.m. And the goal, inshallah, is to have Naseeha run 24/7, 7 days a week, not only via call and text, but also by chat support as well, where other people can reach us through the internet. So our mission. So basically we have two missions. One is for the individual caller, if you will, or user. And then we also have a mission for the communities. When Naseeha started out back in 2006, we started out as a telephone support helpline for Muslim youths in North America. Naseeha Mental Health has grown over the years to support communities and individuals in their journey towards positive mental health and well-being through our toll-free helpline and education and outreach programs. So for the individual, when they're going through that suffering, if you will, and they need to reach out at point, they can pick up the phone and call, and they'll have a peer-to-peer support counselor to guide them through and help them through their issues. Now, as Muslims and as also an organization, we said, okay, it's one thing to be there in terms of a crisis, but what can we do as a community and as an organization to prevent this from even happening? So that's when we established our education and outreach department we rebranded to Naseeha Mental Health because we were no longer just a Muslim youth helpline. So this is where we go into communities. We're trying to break these taboos and these stigmas that we have within our communities. We're trying to raise awareness about mental health. SubhanAllah, in the past 3, 4, 5 years, I think Sister Berak, Dr. Mustafa, you guys would all agree that, mental health in our community, alhamdulillah, has been actually talked more now, right? This is one of the things that Nasimco is looking to do to raise this awareness, because the issues that we're facing, even pre-COVID-19, we're already on the rise. We see all these curves about COVID-19 and anxiety and depression skyrocketing. But as probably Sister Berak, you can attest to, that we've had these issues pre-COVID-19. COVID-19 has actually exponentially made these graphs go, to me, it's interesting because I'm sure there's going to be data studies on this to show the effects of COVID-19 with anxiety and depression pre and post COVID-19. But I can tell you, and I can guarantee you, just from the calls that we're getting at Naseeha, the spike is there. It was there before, but now it's gone up even further. So how can we, basically stop this? And the way we need to stop it is by education, right? A lot of times we've been ignorant to mental health, whether it's through the stigmas or the taboos that we have, but it's just an overall ignorance in terms of mental health and mental illness. So we're out there, we're trying to educate the communities, educating our ulama, educating people. We're at the madrasas, we're even actually at public school boards, subhanAllah. So it's not just for the Muslim community, but we're targeting the Muslim community because we also feel that, we have a lot of cultural baggage, if you will, in terms of the stigma. So that's our mission for individuals and communities. And I just want to go through some highlights for everyone in terms of, where we started, who we are, what we are right now. So we were founded actually in 2006. SubhanAllah, we got our Canadian charitable status at the end of 2016, and we're now an official 501c3 in the US. So once we got our charitable status, we went from being a, volunteer mom and pop Muslim youth helpline to an actual structured organization. We have a long way to go, but alhamdulillah, once we got our charitable status, we're actually, we have that credibility now behind us as a registered charity, both in the US and Canada. All our counselors now, alhamdulillah, are trained. The terminology there that you see is CERT. We have a CERT team, which is a critical incident response team. And all our counselors are also assist trained. So that's a suicide training. And Sister Berak, maybe you can go into that a little bit if you have a chance. Again, like I mentioned earlier, we are now, alhamdulillah, we've grown to now having the helpline open 7 days a week. And that was established last year in 2019. And one of the biggest changes in 2019 is we established a text line. And I'm going to get to that in a little bit as to why that's so important, especially now during COVID-19. Alhamdulillah, we're fully insured. And some exciting news for our 2020, 2021 kind of progress is up here in Canada, inshallah, we're going to be moving into a new office or a new home, inshallah, hopefully by the end of the year, if we're able to raise enough funds. And this is going to be significant because we're now going to be able to offer services such as web therapy with counselors such as Sister Berak. We're also going to be able to offer on-site therapy as well. So it's going to be a big game changer for how we're able to take that user from, onset in terms of that first line of contact, that call, through their journey. And why that's also, very important, because a lot of users in the mental health field, it's a very difficult field to navigate, from having an issue to then getting the help that you need. And there's also financial implications when it comes down to that. So another area where, I want everyone to understand is that whatever we're doing at Naseeha, alhamdulillah, is offered to the user for free. So whether it's the toll-free peer support line, whether it's counseling, whether it's therapy, inshallah, it's always going to be free. And I think it's important that, people realize that, Nasimco came in and they're looking to establish that same thing within their Nasimco Jamaats and member Jamaats as well, that, we should never have a time or place where someone who needs help can't get the help due to financial restrictions. And that's one of our goals that we're aligned as well, with Nasimco, inshallah. Just to give you guys an idea as well, we average around it's about 300 conversations via text and chat per month right now. And that has actually significantly increased since COVID and also Ramadan. And we've held over 100 workshops to date. I'm sorry that this is black and white. It's just some technical issues that I've had on my end. But these are some of the issues that we're dealing with, and I'm hoping people can see this. The top part of the screen is what our call line looks like, and the bottom part of the screen is since our inception of our text. And one of the biggest areas that I want people to kind of focus on here is this 3% here. So 3% of our calls are crisis calls. That's when someone's either in physical harm's way or are going to do something to themselves physically. And why that, it might seem like a small number, but if you extrapolate the data, if you say 300 calls and 3%, that's a significant amount of calls that are crisis calls that come in. So we do have very serious issues such as suicide ideations, such as cutting. These calls do come in. And I want everyone to realize out there that's listening that this is not a non-Muslim thing, that mental health is just applicable to other people and it's not applicable to our community or us as Muslims. This is very real. From our standpoint, we're at a point where we're really, we're tired of hearing the call come in and seeing what's happening, especially to our youths. Suicide itself is the second leading cause of death in North America for people ages 15 to 24. And if you really, think about that, like the stats here in Canada, every single day, if I'm not mistaken, 11 suicides are actually taken every day, and 200 are attempted. That's in Canada. In the US, I believe it's like 3 or 4 times higher than that, right? And a lot of times, like it's taken Naseeha so long to talk about suicide, because everyone didn't want to, everyone wants to shy away from that topic. But, subhanAllah, imagine, think about the people who take their life. That's one stat. But there's 200 people who actually attempt. We're not even talking about those people. What happens to their families? What happens to those people? And, Dr. Mustafa, you could probably attest to this. When you look at like ER, stats and in ER patient lists, we're told, hey, Muslim, like, when I talk to my ER doctor friends who are Muslims, who are on their front line, like yourself, the names on the list are Muslim names, right? Yeah. There are a lot of youth, certainly, adults who are attempting, right? So inshallah, we're, that stat, that 3% stat, since we launched our text line, almost tripled to 8%. And why that's so scary is because, it's kind of like a double-edged sword. Alhamdulillah, since we have text, people who are not comfortable even calling can now text about these issues. And we're seeing many more texts come in that are more serious in nature. So it's very important that our service continues, inshallah, and then we adapt to also, a web therapy as well, inshallah. So those are just a little bit of highlights in terms of stats. As you can see, there's a female dominance in terms of females opening up more than males. And about 40% of our calls right now, 30 to 40% of our calls are actually mental health related in nature. So that's a little quick.
I just a quick question, brother. Why do you think more calls are coming in or being reported from females? I always talk about this in other presentations. I wanted to hear Naseeha's opinion on that.
I think our opinion would probably be similar to yours, and I would always lean to experts as to why that is, because you guys are the psycho experts into how males and females tend to view issues and talk about issues. I'm not a professional psychotherapist or social worker, so my take is more from Naseeha's perspective, or just the man's take. In general, males don't like to talk about their feelings and issues in general. And I think Sister Berak, you could probably attest to that as well. And we see that the stats lean towards that. Unfortunately, men do suffer a lot from these issues. Now, in our communities, the way I see it is that, it's not a manly thing to talk about your feelings, right? For the longest time. So whether you come from India, Middle East, East Africa, right? Is it manly to talk about grief or to cry? No, it's not really the manly thing to do. So we're out there trying to also raise awareness that, hey, look, it's okay to cry. Rasulullah sallallahu alaihi wasallam our Imam Tahirin, they have shown us this, right? You know, when the Prophet lost his wife, you know, sallallahu alaihi wasallam, you know, how long did he grieve for? Not only the prophets, the imams as well, you know, and we have, you know, we have a little bookmark campaign to remind people that, you know, all our prophets, our imams, they went through these issues, and it's okay, you know, to go
I
through.
love those bookmarks, by the way. I have a stack of them in my physical office at the university where I hand them out to Muslim students in particular, and we have them in the waiting room. And they're very powerful because they have the images and the storyline of being raised, let's say, by a single mother, for example, Sayyidah Maryam alayhi salam, or being isolated and alone, like Nabi Allah Nuh in the whale alayhi salam. Sorry, not Nuh, Noah.
No.
So you see, these are issues that we all can connect and relate to. And the Prophet sallallahu alaihi wasallam was raised as an orphan, right? So all of these issues have
yeah, and it's sorry, just it was Nabi Yunus, right? Nabi Yunus in the whale, right?
Yes, pardon me, I've got
No,
my
no,
prophet.
subhanallah. No,
Pardon me. Sorry.
but it's amazing when you think about it, and these were all male prophets, right? So if you say in today's world that, you know, are, you know, na'udhu billah, that one of these prophets were less of a man, I don't think anybody would say that, right? These were, you know, our greatest role models that we should be looking at. So in looking at these people, even our imams, that, you know, when they suffered through these things, they did suffer, and it's okay. It's okay to suffer, but know that there's ways to get help and seek help, right? That, you know, just, you know, Dr. Salehmohammed, if you get cut, if you have a headache, you have a cold, you go see a doctor, right? I think we need to normalize mental health a lot more within our community. So the bookmarks were, you know, meant and geared towards that, to show people who are using them that, yeah, these people went through these issues, our prophets and imams, and it's okay that we go through these issues.
Absolutely. It's so important to be able to normalize like that.
Absolutely. I don't want to take too long on this budget slide, because this is not meant to be any sort of fundraising or anything like that, but it's important that we talk about our transparency to our donors, and through organizations that do support us. So for the past 2 years, you know, when you look at this slide, it's a $1.4, $1.5 million budget. That's not what we're bringing in. You know, we're $1 million short of that budget. So for Naseeha to get to a 24/7 model, to be able to have actual paid psychotherapists and social workers on staff, we need to get to this budget, and we're asking for everyone's support. Inshallah, with Nasimco's help and other, you know, member jamaats and supporters and donors who are listening to that, especially during Ramadan, you know, if you can help us out, definitely please consider that. So I'll just move on to the next slide here. So how are we helping today? You know, pre-COVID, we were already out there doing our workshops. When COVID hit, subhanAllah, all of our events, I'm sure, Berak, you can attest as well, everything got canceled. All our physical events got canceled. So how did we change? So alhamdulillah, COVID's been, I would say, a blessing for us as well as Naseeha, because we've pivoted in terms of using tech. Today, subhanAllah, we're on Zoom. And as a result of that, we have been able to impact a lot more people. So our reach is even further than even North America. And the way we've done that is we've created videos. So we have videos that actually are out there on YouTube, Facebook, and inshallah through Nasimco as well. We'll be airing those videos where, you know, we have strategies and techniques dealing with issues such as anxiety and coping mechanisms. You know, subhanAllah, you know, we always think as doctors, for example, Dr. Salehmohammed, I'm sure, you know, there's a bias out there that, oh, our doctors, they're going to be okay. But subhanAllah, even our doctors right now during COVID are suffering tremendously with anxiety and stresses. I can't tell you how many doctors I know that are telling me every day, like, subhanAllah, Dr. Mustafa, like the fact that you got to come home, quarantine yourself for 2 weeks during Ramadan, right? I don't think the rest of us can actually fathom that, right? You know, we're dealing with our anxieties where, you know, we can't go to the mosque and break iftar. SubhanAllah, you guys can't even come home and break iftar at your own home, right? So,
and I think what it's also done, it's exposed for healthcare workers that this is probably an underlying issue regardless of COVID.
Absolutely.
So this has just brought it to the forefront, and then hopefully it'll help in general times.
Yeah, and I hate to say it this way, but I'm glad that through COVID, and I know this might sound, you know, not the greatest, but, you know, through COVID-19, mental health now is a little bit more on everyone's radar, which it should be, right? So videos are one of the ways we, you know, we've developed it, we've curated the videos. And by the way, these are curated by people such as Berak, who are psychotherapists, who are professionals in the field. It's not by a guy like me who's, you know, the head of development. So alhamdulillah, there is credibility behind these, and you know, there's a lot of statistics as well that credit these videos. Webinars, alhamdulillah, we've been out there. When COVID hit, we started our COVID series. Now that Ramadan has hit, we're continuing that. So we have a resilience during Ramadan series, and inshallah our next airing of our webinar is going to be on May 9th. We have daily tips, right? So now, even pre-COVID, through COVID, in Ramadan, every day, if you're signed up through our social feed, whether it's Instagram or Facebook, you're going to get tips to help you out every single day. And the last one here is Naseeha circles. This to me is very important because this is a closed environment where our youth, seniors in high school and university students can really open up with a professional. And usually we also have a chaplain as well from a Muslim perspective to be there for them. The last circle that we had, now that it's online, people from all over the world can access it. People from all over North America can access it. We don't have to physically go to a university anymore to put on a circle. So the accessibility now for everyone is far greater now. So alhamdulillah, we're very happy that we've been able to pivot. We've been able to keep our call lines open. Inshallah, we're looking to expand our hours. So this is how we're helping today. So, you know, for everyone who's watching, you know, I pray to, you know, Allah subhanahu wa ta'ala to keep us protected, keep us all healthy. Inshallah, if you guys can, especially during Ramadan, if nothing else, spread the word now that you know about Naseeha. Everyone should know about this. This is what Nasimco is trying to do, to let their jamaats, let their community members know that, listen, there is a place to go for help that has an Islamic approach to the help that they're giving. And people should not feel like they're isolated or left alone. Too many times, like if you're in big cities, you know, Dr. Mustafa, you're in New York, I'm in Toronto, Berak, you're in Ottawa. We're in pretty big cities, but there are a lot of people, like even in our big cities, people are suffering, but there are a lot of people who are in remote places, right? And unfortunately, we can't even get to them, like physically touch them. So inshallah, through online support, we're going to be able to actually help those people out as well. And inshallah, just please, if everyone can, just make dua for Naseeha, for Nasimco, for Sister Berak, for everyone, so that we can continue this fight in terms of bringing about this awareness and inshallah, helping put a stop to some of these mental illnesses that are unfortunately at an all-time high for our community as well.
MashaAllah, bless you and Naseeha for all the incredible work that you do. I'm trying to remember, when was the first time I heard about Naseeha, and I don't recall at the top of my head.
So I'll tell you,
okay.
You actually did a workshop. I think it was through the Afghan Youth Committee up here in, I want to say it was here in Toronto.
It was before that. No, our connection was way before that. We had gotten Naseeha together with this event, but the contact was before. So I'm just trying to remember.
It was before.
Yeah.
And inshallah, now it's going to be at the forefront. Inshallah, we're going to get to do more, inshallah. It's important. It's very important that we're out there together, that the psychotherapists, the social workers, and subhanAllah, we have a lot of Muslim people in mental health in the field, and we're calling out on these people, such as Sister Berak, to do these types of programs, to get into the communities and help out the communities. And inshallah, Naseeha is going to be there as the mental health support organization, if you will, inshallah.
Inshallah. I just had a memory of at least 5 years now since we did the Serenity Islamic Mental Health Awareness Conference in Ottawa, where you couldn't come in person, but you provided us as a sponsors with tons of resources to give out to our clients and our participants, rather. I'm always in client mode, to the participants who attended the conference. And we had beautiful posters, and I think there was stress balls as well with Naseeha, but I knew it was before that. And the point I'm trying to make here is, I was quite delighted as a psychotherapist working in the field, who I do have clients of different faiths, including Muslims, to have a Muslim mental health support. I was thrilled to see that. So I'm not sure how the connection happened, but it did. But then I've always had that resource in my office and events that we do, whether it's through the Muslim counselor or through Serenity and other mediums, to say, hey, we have a hotline here in North America for Muslims. Just like in the UK, we have the Muslim Youth Helpline over there. So it's so important to have that. Now, with this in mind, having this resource, we also can take a look at in terms of anxiety, what's happening in North America, specifically in the States. We see that nearly 7 million people in the US are affected by generalized anxiety disorder, also known as GAD, and about 6 million with panic disorder. So these numbers are expected to go up, obviously, over the next few months. And so if we go a step further, we'll look at the symptoms from the Center of Disease Control about mental health stress during an infectious disease outbreak. And these symptoms can include fear and worry about your own health and the health of your loved ones, which is something the doctors already discussed, changes in sleep and eating patterns, difficulty sleeping or concentrating, worsening of chronic health problems, worsening of mental health conditions, and increased use of substances such as alcohol, tobacco, and other drugs, which we know is happening also within our communities. So given these statistics and that we have from these sources, what does it look like in terms of the increase of calls that you've had with Naseeha?
So it's amazing, and I want to kind of put this into perspective for everyone, right? So when COVID hit, right, we were expecting, just like everybody else, this immense spike in calls. But for the first couple of weeks, actually, what we saw is people were actually afraid to call. So picture someone a youth, right, is at home. Now that the parents are home, they're not going to be in a comfortable position to actually pick up the phone and call. So what we noticed is our times actually went down. So on average, let's say we were averaging 30, I think it was like about 30 to 35 minutes on the calls. We started noticing a significant drop in that call. So people would be only on the phone for like 5 minutes, 9 minutes, then they would drop off. And we were like, okay, what's going on, right? And then we would have spike days, right? So it would be like this roller coaster, right?
And it's funny, brother, just quickly with this point before you explain,
No,
we've
please.
seen this in Ottawa with the calls for the domestic violence support. There was a decrease in that because of you are now isolated with your abuser. Therefore, you cannot be on the phone and call. So it's interesting to see the correlation here, or the similarity rather, that we see this also happening with the Naseeha helpline.
Yeah. So and this, it's important because you hit on something very important that people need to realize. Again, I keep on reiterating that, this happens in our community, right? So whatever's happening outside in terms of the normal society, we're seeing the same correlation. The stats are very similar, right? So we saw this bounce, if you will. So this is why it's so important that our text line was also open. Okay. So now if I'm calling and I'm having a problem, whether it's domestic abuse, whether it's spousal abuse, whether it's a child being abused or they're scared, at least they can text now. So that person, the abuser, as you pointed out, can't hear me speaking. So I can text. So we saw an increase in our text, and that's been gradually going up as COVID's been going up. So it's very important. So what we've done is we said, okay, hold on a second. We're seeing this trend. Let's make sure that all our counselors are trained up. So our goal is by, in the next couple of weeks to have all our counselors trained as text counselors as well, because there's a training. It's a completely different animal, if you will. So on a phone call maybe 20 minutes could actually take an hour just to text. Hello, what's the problem? How can I help? Right? So that's been one of the trends. The other scary trend that we're starting to see is the severity of what anxiety is doing to issues. So pre-COVID, if you will, an altercation might be able to be diffused or might just get diffused, by itself. Maybe someone will walk out of the house or someone can, go away from that environment. Now that they're stuck in this environment, so to say, because of isolation, a little altercation we have seen can turn into something a lot bigger. And unfortunately, that's happened, without revealing, details. But, we've had issues where an altercation between a parent and a child, and, a child all of a sudden lashes back out at the parent, and the parent gets hurt to a significant point where they actually have to be hospitalized. Stuff like that wouldn't happen. I mean, it does happen, but it's more rare. But now we're seeing that because people are in this very stressed environment, that a small little argument can turn into something so much more. We're seeing and we're hearing about statistics out there with divorce, for example, with spousal issues. And we're seeing a lot more calls now come in from not just the youths. We're seeing a lot of marital problems, marital issues we're getting calls on. We're getting calls from business owners who are struggling because their business has been impacted where they're about to shut down. We have families who are in businesses where the husband and the wife, have gone into business, subhanallah, and they're, a new business takes about 3 to 5 years to get off the ground. And now COVID has impacted them to such a degree where, not only is their business suffering, but their marriage is suffering, right? And then the kids suffer from that. So there's a lot of, like Dr. Salehmohammed was talking about, the stresses that are out there are real, and people are going through some pretty hard times right now. So it starts with, let's just say, losing your job, but then there's a food issue, then there's a shelter issue, but all these tie in heavily to mental health. So we're seeing that the calls, since Ramadan have doubled, for the past few days, and it's scary because we're not even at capacity, right? We're already, pre-COVID, we already have our issues in terms of how many calls we receive, how many can we answer, right? But now that has grown, right? So it's a scary time for us, but we're doing our best in order to make sure that we're there to support. And I think it's very important that we actually have these online mechanisms. We have webinars, so that people can get that support. Simple technique, Berak, like box breathing, for example. You're aware of this, right? Something as simple as having that resource available for a person at home to just watch and see, hey, how can I breathe and calm my system down, so to say, right? So this is the trend, and it's real, and we are seeing it. So yeah, just to answer the question, yes, I mean, we are seeing a trend upwards, unfortunately, in these issues.
I remember you mentioned something earlier, and it'd be interesting to see research done during this time, whether it's from the medical perspective or mental health, to see how this has impacted people. I mean, we're getting some right now, but later on, inshallah, when the pandemic is finished, how we survive this, because I think we're all in survival mode right now, where our stress levels are really high because of the excretion of cortisol and other stress hormones in our bodies, right? And so this is how we're feeling, perhaps the low immunity, or feeling that we're getting sick. I'm sure a lot of us have felt, just going to the store and coming back, like the doctor mentioned earlier, that there's so much stress involved when you come home, and then you have to disinfect everything, and the fear of, oh, did I get everything? Just that feeling itself. I remember feeling so sick afterwards. And my friend, I reflected this with a therapist friend who said, well, Berak, you are in such a stressful environment, even if we're now going around like this, this is the norm now. I feel safer going around like this than before in our hijab. It's almost like a joke how this is flipped, ironic. But coming back home from that, the stress levels, can only imagine like how later on, how when we look back at this time, simple things like that, how they've had such a huge impact on us, right? And so when we take a look overall in terms of why this is important, what Nasimco is doing, what Naseeha is doing, what the role of the therapist, and how people can reach out, just in terms of mental health, there's no denying it anymore. There's no pushing it aside. There's no blocking it. No, none of that. We are openly speaking about mental health, alhamdulillah. It took years and years of work from the mental health professionals and people who are passionate about overall well-being and health to recognize it as something very important in our communities. We see this now in the majalis, on the mambar. We see our scholars exploring this, and even in the houses where they now are introducing Islamic psychology, because it's always been there, but now it's going to be in terms of a formal form of study for scholars, because we know in our communities, the frontline workers in our centers are the sheikhs and the scholars and the alimas, right? They're the frontline workers that, so to speak, get the challenges from family problems, right? Marriages, and you were talking about divorce, how right now stress is so compounded, a small thing is just blown out of proportion because of how high our stressors are. So we have now, alhamdulillah, a growing network, not just professionals, but spiritual leaders in our communities who are recognizing how important it is, and they are speaking about it during the majalis, including during Muharram. We hear that, and they are normalizing it. So the key thing here is how to normalize mental health. And we all have mental health, just like we have physical health, just like when we have to deal with a cold, just like we have to deal with diabetes, cardiovascular, whatever medical issue, physical health, We have that. Just like in our mental health, the balance of that. When does it become an issue? When we don't take care of it, when we don't balance all the aspects in our lives of components of wellness. So it could be financial, social, family, work, spiritual, all of these aspects. When they're not in balance, then you're off balance, which means that you could be impacting your mental health. How does it become an illness? Well, we know it becomes an illness, again, if it is continuously not taken care of. Just like when you have a cold, if you're not going to take care of it right away, do the home remedies or go see a doctor, if it continues, then of course it could develop into something worse. So this is the language that we're using when trying to normalize mental health in our communities. And alhamdulillah, we can successfully say, by Allah's grace, that we've gotten to the point where we now have whole conferences on mental health. We have full journals doing research on mental health from a Muslim perspective, I'm specifically talking about. And we have young people going into the work of mental health, to being, whether it's psychiatrists, psychologists, social workers, mashallah, it is growing and growing. And the professionals who we already have in the community, finally creating networks with different projects that are up and coming, including a project that is being developed in Ottawa. And I'm gonna bring it out here as well, because inshallah we'll be working soon together. The Sakina Wellness, which is developed by a group of people, not just mental health, but different backgrounds who are passionate about mental health, which shows you that our communities are finally open to listening and not just starting the conversation, but actually doing something about it. And so I could attest to this from the work I do within the community, and also the Muslim clients that I do see in my line of work where I work at the university medical clinic. We see more and more students of different cultural backgrounds, including Muslim, coming, seeking for help. But the taboos are still there in terms of, oh, I can't share this with my family. What are they going to say? I'm so ashamed to talk about the haram that I've committed. But we see that these issues impact people's overall mental health. And if they keep it cooped in inside, then it can get worse and worse, because then it impacts your daily performance and your functioning. And so this is when mental health issue becomes a mental health problem, when it impacts your daily functioning, just like it would with a physical issue. So alhamdulillah, we can say we have gotten to this point now, and where we're discussing this openly with professionals and all sorts of people from the Muslim community. And I can also attest to the fact how COVID has impacted clients, whether it's where I work, but also what I'm hearing in the community. There's a lot of fear and anxiety at the beginning when this first happened. In fact, we probably didn't really take it seriously when we were seeing what was happening in China, when we were seeing what was happening in Italy, until I can say here in Ottawa, we got our first case. The next day, the schools were shut down, leading into March break. And after that, immediately, our university went back to classes right before exams. So we can see how quickly that impacted us. And then we all started working from home as well. I think we're in week 7 or 8 now. So we can see how the impact of the pandemic quickly changed what our normal was to a new normal. And psychologically, when you are impacted by trauma, by crisis, by unexpected stressors like that, it changes you. You are off your balance. You don't know how to deal with it. But subhanAllah, at the same time, we have such great coping skills and resilience in terms of adapting to change. One of my colleagues at work was talking to me about statistic-wise. She said it takes around 3 months for people to adjust to this. Not sure what the exact resource of that is, but we were having a discussion about that. In my mind, I'm like, you know, it could very well be this 3 months, because now we're into week 8 around that time, and we are seeing that we've adjusted somewhat in terms of working from home. We've accepted the reality that when we go shopping, ABC happens, and we've accepted the reality that our kids are home, we're homeschooling them, and we've also had to deal with grief as well, because there is a loss in this. And this is from, I forget the name of the professor who talked about this, but she described this whole process almost like a huge grieving process, where we have lost out on events, on conferences, on weddings, and us as Muslims, the gatherings we have in Ramadan. This is a loss. And of course, the loss of loved ones. A lot of our families and friends have been impacted by COVID directly, by losing loved ones. And so we can see how overall the pandemic, from a mental health perspective, from a physical medical perspective, how it's all impacted us on so many levels. And inshallah, through these webinars and through other amazing resources out there, because everyone's gone virtual. I think a lot of our homes have become Hussainiyas now, which is great, or educational centers with the knowledge, and people can also become overwhelmed by what is available. So what we advise is select, especially during Ramadan, select a few speakers that you do enjoy speaking to, or a topic that's of interest to you, and stick to that. And same goes everywhere else. Now, somebody did ask a question before we wrap up. They asked in terms of how does family counseling, in terms of serious family issues that strain well-being, factor into mental health? So I interpret this question, and if you can help me out, please, doctor and brother, in terms of like how does it help? Well, I could say that definitely counseling will help you deal with the strain of family issues. And if you call Naseeha, or if you have a virtual counselor that you can talk to, just speaking to somebody who is objective, speaking to somebody who has the skills, active listening skills, empathy and compassion, can relieve some of the stress that you're dealing with, but also give you some strategies. What are your thoughts on that, brother and doctor?
So I'll jump in real quick before Doctor, if you don't mind, Mustafa.
Sure.
No, I totally agree, Berak. I mean, from a Naseeha standpoint, we've seen that just by picking up the phone and having someone to listen to you goes a long way. Talk therapy, right? They call it, right? So talk therapy itself, a lot of times, like, you know, when you're cooped up and you have nowhere else to go, nobody listen to, you know, for example, myself and my wife, if she's not listening to me, who am I going to talk to? Right? So just by talking, or vice versa, usually it's vice versa, right? Who does someone turn to? So just by talking to someone is a form of therapy in itself. Just being able to kind of release, or, you know, that stress out, that's a form of therapy. Then after that, you know, coping mechanisms, strategies, alhamdulillah, our counselors will be able to help people with that. But then if it reaches a point where someone actually needs therapy, we're able to then refer to people such as Berak, for example, right? Where people can then get that help. I mean, during COVID, it's a little bit difficult. So there's a lot of, I think there are web therapy platforms out there. But inshallah, you know, I think it is definitely important for people to seek the help that they need, and it's okay. And that they're not alone. Everyone's in that same boat. We're all going through that same isolation, if you will. So the stress is there for everybody. So Mustafa, if you want to.
Yeah, it's just, you know, it's an interesting question as far as family counseling goes, right? We look at individual health, we look at individual mental health, but if we look at the evolution of a family throughout time, you know, our physical health evolves together. We sort of are healthy or unhealthy together as a family unit, and the same goes for mental health. So that family unit is also, you know, sometimes treated as a unit, and our mental health as a family will be good or bad together. So seeking family counseling together, I think is very important, just as it is on an individual basis too.
And I think I just want to add in, I think it's important to encourage that within the family unit. So if you're sitting at home, encourage your kid. Hey, look, if you can't talk to me, right, you know, there's a place to go. You know, hey, husband, wife, you know, let's not get to that point, right? Let's kind of do our preventative way. If there's something that you want to ask, or understand or learn, you know, it's a good opportunity to learn, right? As well, right? So
yeah, it helps get rid of that stigma of it's okay to seek help outside of your unit.
Correct.
So,
Correct.
Absolutely. And when you take those steps, inshallah, you know how we say, when you take those steps towards Allah, He will come more towards you. Same thing here. You have to take the first steps in terms of reaching out for support that Allah has provided you through these different means, because one of the misconceptions we have in our community is, you know, you should rely just on Allah, just on ABC, and you have a lack of faith, you need to increase faith. But in fact, Allah subhanahu wa ta'ala has provided resources to get that help through all of these mediums, mashallah.
Exactly.
Thank you so much for this very enlightening, deep, at the same time, you know, just hitting the surface with the topics of mental health. Inshallah, we'll delve deeper in the coming weeks in different topics, inshallah, whether it's domestic abuse, whether it's addictions, and if there's also topics of interest that our community is interested in, please do send that to Nasimco or myself. I'm not sure how to get it through Naseeha, but we're all collaborating together. So if you send your requests in terms of what you'd like to learn more about or issues that you're concerned about, inshallah, we'll look into exploring them. Thank you so much, brother and doctor. Bless you. And
Thank you.
inshallah, bless all of our community members, the frontline workers, and du'as and prayers for everybody, inshallah, during the holy month of Ramadan. Please keep us in your du'as. And inshallah, we'll see you next week. Don't forget to check out all the other webinars that are happening with the different groups, including with Naseeha. They've got great lineups of programs, and Nasimco as well, inshallah. And also some of the programs I'm doing. I've got another one coming up soon.
5 o'clock. 5
Yes.
o'clock.
Yes, and another one tomorrow on personality building. So, alhamdulillah, really busy, but these are beautiful programs that we're all working together during the holy month to provide for our community so you don't feel isolated, especially during this time. Thank you very much again. Assalamu alaikum wa rahmatullahi wa barakatuh.
Assalamu alaikum.